Good evening, Dr. Batra. How are you?
Wonderful. From another part of the world for you. I'm in Dubai, just landed this afternoon. Changed my flight so that I could be on call with you.
Really appreciate that. Thank you so much for that. You know, I love the commitment that you have for your audience.
Any
It's
part of the world, always
absolutely.
there for you and for everybody
Thank you so
else who wants to
much.
learn a
Means a
little
lot.
bit about homeopathy.
Means a lot, sir. Means a lot for us. So we have people joining in. We have Dr. Krishna Arjun Reddy. Uh, we have variously Anish, Syed. And let's wait for a few moments before, while we have other people join in. Dr. Batra, today we थोड़ा सा हल्का सा एक change करेंगे. If we can do this as a English thing.
Okay, so
So that, I thought let there be a little twist to what we are doing. तो थोड़ा बहुत हिंदी का flavor भी कर लेंगे so that ज़्यादा लोगों को पहुंच सकें.
As you say, you're the boss. So always.
And आज का टॉपिक भी इंटरेस्टिंग है. किडनी स्टोन, किडनी एलिमेंट. सो स्टोन्स के बारे में बहुत सारे क्वेश्चंस वी बीन गेटिंग हमें आए हैं लोगों से.
गुर्दे की बीमारी, गुर्दे के पत्थर. So we have Vishnu joining us just now. Vishu joining us.
Vishu, welcome Vishu. So Anishi, Vishu, Dr. Krishna Arjun, what we would really appreciate is if you have questions, please do put your question in the comment box. It is always more valuable if we have an opportunity to answer questions that are coming from the audience.
Yes. And also talk about what we like to talk about next week, since we are still waiting for people to join. Maybe you could.
I have been since yesterday talking to a lot of people. So we've had various suggestions coming in for topics, but one topic with popular demand that we have thought of is hair fall.
Oh my God! Okay.
So do you think if that is a topic that we could take up?
Sure.
That would be interesting. I mean, at least for the age group that I am in, this seems like a very popular topic.
Any age group, believe me, any age group.
Yes.
It's a hot topic to keep the hair on your head.
It is.
Yeah, we'll talk about it next time for sure. I thought
Absolutely.
we've spoken about it earlier as well. I thought we have. I'm not sure.
हमने एक बारी करा था. Yes, that was a long time ago. But this would be an interesting topic. So I think we could take it up again.
Sure.
So in the interest of time, Dr. Batra, हम शुरू करें.
जी, please.
So इस बारी since we have chosen to do it in English, हम हिंदी को भी include करना चाहते हैं ताकि ज़्यादा से ज़्यादा लोग इस शो का बेनिफिट ले सकें. तो जब हम गुर्दे की बीमारी की बात करते हैं, सबसे कॉमन चीज़ जो हमारे दिमाग में आती है दैट इज रिलेटेड टू किडनी स्टोन्स. जो स्टोन फॉर्मेशन किडनी के अंदर होती है, ये बहुत पेनफुल होती है, बहुत डिस्टर्ब करती है लोगों को. तो ये किडनी स्टोन होता क्या है और ये कैसे फॉर्म होता है?
तो सबसे पहले तो मैं ये कहूँगा कि ये जो गुर्दे की ये जो बीमारी है, जो पथरी जो है, I call it a millionaire's disease, and I call it a millionaire's disease for two reasons. सबसे पहले इससे मैं millionaire's disease इसलिए कहता हूँ क्योंकि 1 मिलियन लोग जो इससे पीड़ित हैं हिंदुस्तान में. 1 million people suffer from it, so that's why I call it the millionaire's disease. And the second thing is that it is formed by crystal. Now ये जो crystal है, ये पथरी है. Unfortunately, that crystal is not a diamond. So it's actually a collection of all kinds of chemicals and salts which kind of mix together and then they form a little stone, little or large stone. So really, this is how stone is formed. It's formed because of a collection of chemicals, deposits, which kind of get together and then they form a little stone. There are different types of stones which we can talk about a little later, and many causes for it. Right. जिसके बारे में बाद में बात करेंगे, चर्चा करेंगे.
हाँ. तो ये क्या hereditary होते हैं? Is it something that moves from one generation to another?
ये बात काफी सच्ची है. तो मैं ये कहूँगा कि कम से कम इसके 4 या 5 कारण होते हैं. और जो सबसे पहला कारण है वो hereditary है. It is believed that almost you have a 56% chance of getting a kidney stone if it runs in your family. तो सबसे पहले जो डॉक्टर करेगा, अगर आपको किडनी स्टोन है, पूछेगा, आपको ये पूछेगा कि आपके परिवार में ये बीमारी है किसी को या नहीं है. That's the first thing that they will always ask. Right. So 56% chances in case you have a family history. The second largest reason or the biggest reason is dehydration. तो जब हम जो लोग ज्यादा पानी नहीं पीते हैं, और because what happens is that then the urine gets condensed and it doesn't, so all this it's like the clogging of a pipe. जैसे नाली में जो है वो गंदगी भर जाती है and then it chokes. उसी तरह से ये भी जो है ये choke हो जाता है and then it forms a little stone. It collects together and forms a little stone. So when you don't drink enough water or when you are dehydrated, then there's a 50% chance of getting kidney stone. So ये जो है ये दूसरा आम कारण है. तीसरा आम कारण है मेडिकल कंडीशंस. यानी कई बीमारी ऐसी होती हैं जिसकी वजह से स्टोन की ज्यादा संभावना होती है. जो हम सब लोग जानते हैं वो है गाउट. गाउट में जो है यूरिक एसिड होता है और यूरिक एसिड स्टोन भी फॉर्म होता है. तो उसकी वजह से जो है किडनी स्टोन भी हो सकता है. दिस इज अबाउट 30% ऑफ पीपल. सो इफ आई गो इन ऑर्डर ऑफ इम्पोर्टेंस, द फर्स्ट hereditary 56%, then 50% dehydration, then 30% medical problem, and then I would go back to another very important part which is a lot of people don't know, which is certain medication. So जैसे कि अगर आप ज्यादा विटामिन सी ले, हमको लगता है कि हमें सर्दी हो रही है, सर्दी से बचाव के लिए या इम्यूनिटी बढ़ाने के लिए हमें विटामिन सी लेना चाहिए. पर अगर आप विटामिन सी ज्यादा मात्रा में लेंगे, then there's a chance that you may get kidney stones, especially if it runs in your families. So you should be careful about the amount of vitamin C that you are taking. इसी तरह से ऐसा भी माना गया है कि जो हम जुलाब लेते हैं, laxative जो लेते हैं, to get a loose motion or a normal motion, excessive intake of that also causes kidney stone. So, and like this there are many other migraine medicines, for example, antidepressants, anti-anxiety, some anti-anxiety medicines also give rise to kidney stone. So ये बहुत जरूरी है कि अगर हम कोई दवाई ज्यादा समय तक ले रहे हैं तो हमें डॉक्टर के पास जाना चाहिए और उसकी जांच करानी चाहिए. Because it's quite possible that it can also form because of certain medications that we are taking.
But typically, डॉक्टर बता किस टाइप के symptoms आप फील करते हैं as a patient
जी,
जिससे आपको लगेगा कि मेरे को किडनी स्टोन्स की जानकारी भी कर लेनी चाहिए या इसके बारे में मेरे को पता कर लेना चाहिए. Should you meet a doctor to check for kidney problem?
So मैं ये बताना चाहूंगा कि दो चीजें सबसे पहले before talking about these symptoms. Number one is that very often people carry kidney stones to the grave and they don't even know it.
Okay.
So a lot of kidney stones are actually asymptomatic.
Okay.
So ये हम सोचते हैं कि बहुत दर्द होती है, पेन होता है, but it's not always. So let us understand, number one is that stones can remain silent and they can be buried there forever with no symptoms whatsoever. So it can be asymptomatic. That's the first thing. The second thing is that is also that अगर आपके पास 4 मिलीमीटर से कम की मात्रा का स्टोन है, साइज का स्टोन है, ऐसे माना जाता है. It's not always true, but ऐसे माना जाता है कि अगर 4 मिलीमीटर से कम की स्टोन है तो 30 दिन के अंदर वो ऑटोमेटिकली पास हो जाएगा.
अच्छा.
So again, smaller stones, by drinking more water, by flushing out your kidneys, they pass out naturally. So then there's really nothing to worry about. So I'm saying, let's understand that sometimes kidney stones may be there and they come only by accident. I mean, आपने sonography कराई, आपने X-ray कराया और उसमें पता चला कि आपको kidney stone है. So they can be silent. Okay. Now, when they are loud, when they make noise, then you get a lot of pain. So the first symptom is pain, दर्द. यानी बहुत जोरों से दर्द होता है और पेट का दर्द होता है और फिर it goes to the groin. It kind of radiates from the stomach to the groin, and it's very often violent. Sometimes you can even faint with the pain. It's that severe, and it can be on either side depending on which side your kidney stone is. So pain is the first symptom. Okay. The second, like I said, is accidental. Only you find it in a general examination. By chance, आपने सब टेस्ट कराया और उसमें by chance निकल गया, and you realize that you have a kidney stone, asymptomatic. Third is burning in urine, and what we call hematuria. यानी कभी-कभी क्या होता है, पेशाब में जो है जलन होती है और उसमें UTI हो जाता है, इन्फेक्शन हो जाता है यूरिनरी ट्रैक का, what we call UTI, और उसकी वजह से जो है कभी-कभी जो है, especially when there's a sharp stone, हम एक स्टोन होता है उसको हम स्टैगॉन कहते हैं क्योंकि इट्स वेरी लार्ज एंड इट्स लाइक द हॉर्न ऑफ अ स्टैग, यू नो, जैसे बारहसिंगा जैसे रखता है, तो उसे स्टैगॉन कैल्कुलस कहते हैं. जब वो होता है तो उससे थोड़ा सी ब्लीडिंग भी हो जाती है, एंड समटाइम्स वेरी ऑफन देन यू आल्सो गेट ब्लड इन योर यूरिन. सो अगर आपके पेशाब में खून जा रहा है, अगर आपको दर्द हो रहा है, यू नो, पेन हो रहा है, व्हिच इज रियली द कॉमनेस्ट थिंग, एंड समटाइम्स देन यू आल्सो गेट नॉशिया, यानी ऐसा जी मचलता है, उल्टी करने को जी चाहता है. These are some of the common symptoms, bleeding in urine, urinary tract infection. And urinary tract infection means you realize it because आपको बुखार आएगा, उसके साथ सर्दी होगी, fever with chill. That's one symptom of UTI, urinary tract infection. So if you're feeling cold, getting chill and have high fever, think of UTI. Get your urine tested. You'll find that there are pustules in it. You may find some RBCs in it, and when you do your sonography, you'll find somewhere there's a kidney stone. So these are some ways that you can know. And I think one more thing that I like to add over here also is कि कभी-कभी क्या होता है, and this is only from my experience for 50 years. It's not really part of a lot of medical books. पर मैं ये बताना चाहूँगा कि मैंने अक्सर ऐसा भी देखा हुआ है कि काफी लोग जो है वो जब ब्लड प्रेशर चेक कराते हैं और उनका ब्लड प्रेशर हाई होता है, तो हाई ब्लड प्रेशर का एक कारण, इट्स नॉट ऑलवेज द रीजन, बट एक कारण जो है वो किडनी स्टोन होता है. तो अगर आपका ब्लड प्रेशर हाई है और कंटिन्यूसली हाई है, तो आपको, क्योंकि क्या होता है उसमें ब्लॉक हो जाता है और ब्लैक प्रेशर हो जाता है, बैक प्रेशर की वजह से ब्लड प्रेशर बढ़ जाता है. सो समटाइम्स इवन व्हेन यू गो टू अ डॉक्टर एंड यू चेक हाई ब्लड प्रेशर and then he'll ask you a few questions, and if there's a family history of kidney stone, you should check it out. हो सकता है कि आपको भी किडनी स्टोन हो.
जी. So before I go to the next question, I'd like to welcome the other people who've joined in: Namrata, Sonia ji, Kanishk, Rawat ji, Abhishek, Tiro, Mitali Gupta, Dr. Gitanjali, Tanvi, Ishwari. Thank you so much for joining in. Your presence means a lot for us.
Yeah, Akshay as well. He's joined us. It's lovely to have him here.
Yep. And Dr. Batra, लॉन्ग टर्म कॉन्सिक्वेंसेस क्या है? बहुत बारी हम जब किडनी स्टोन होता है तो डॉक्टर के पास जाते हैं, डॉक्टर कहता है कि अगर आपको डिस्टर्ब नहीं कर रहा, इसको छोड़ दीजिए, कुछ करने की जरूरत नहीं है, डोंट गो इन फॉर सर्जरी और एनीथिंग. तो लेकिन ये स्टोन को छोड़ देने के नुकसान क्या हो सकते हैं? इज देयर अ लॉन्ग टर्म प्रॉब्लम दैट कुड बी देयर?
सो लाइक आई सेड, जैसे मैंने पहले कहा था कि इसके 2 या 3 प्रॉब्लम्स हो सकते हैं, नहीं भी हो सकते हैं. सबसे पहले तो यह है कि like I said, it can be silent and you don't need to do anything, and it can be asymptomatic and you can just let it be, rest in peace, nothing will happen, allow it to be there. But sometimes what happens is it depends again on the position of the stone and the size of the stone. ये बहुत जरूरी है क्योंकि कितना बड़ा स्टोन है, कहाँ पे है, और कभी-कभी क्या है, अगर ये स्टोन ऐसी जगह पे है आपको पता भी नहीं चलेगा, but you get a condition called hydronephrosis. उसमें क्या होता है कि because of back pressure the kidney starts enlarging. And then it shrinks. Then you get actually kidney failure, what is called CKD, chronic kidney disorder. Where you have to then go for dialysis and all that. But the good thing is that most people don't even realize it, क्योंकि हमारे पास 2 किडनीज हैं और अगर एक काम नहीं करती तो दूसरा जो है वो ज्यादा काम करती है, and it compensates, which is why also this is one organ that you can donate. यानी ऐसा माना गया है कि you can always donate one kidney to a relative or somebody else, and you can save another life, because one kidney is enough to keep you going for the rest of your life. So जब दोनों kidneys fail हो जाती हैं, then you have a problem. So having a kidney stone in one kidney, and just, I mean, it's good to be careful, but like I said, you can get back pressure, you can get hydronephrosis, you can get swelling of the kidney, and then you can get shrinking of the kidney, and then you can get chronic renal failure ultimately. which is why you should be a little careful. That's all. But it's not always true that and the other thing I like to mention also is ऐसा भी माना गया है कि अगर आपको किडनी स्टोन है और समझिए निकल गया है, so then there is no problem because निकल गया, so there's nothing to worry about. I mean, it happened once, it's out. But the theory says that there's more than a 50% chance that within 5 years you'll get it back again.
Okay.
So when you get recurrent kidney stones and when it gets blocked, so just to show you in a little bit of a diagram, like this is the kind of I'm a terrible artist, but this is the kind of a kidney shape, and this is where you get the ureter, which is the pipe that goes down, then it goes to the bladder, and then it passes out like that. So the beautiful thing is that agar yahan pe kidney stone block hai, then it is blocking this. It can't allow the urine to pass, and therefore this kidney will keep increasing in size and then ultimately shrink.
Okay.
And get affected. But if it is somewhere here in the ureter, it will cause pain because it's a spasmodic pain. You get this spasmodic thing. It tries to push itself down and then pass out even naturally, and of course with medication as well. So if your kidney stone is in the ureter or in the bladder, the chances of it coming out are much easier with medication, even without medication. If it's in the calyx, as we call it, which is the center of the kidney, then the chances are less. And again, agar upar hai, to chances are little better because it can come out with gravity. Agar niche hai, it has to come against gravity. So this becomes very difficult because then you have to push the stone up and then out. That's very difficult.
Right.
So the prognosis of treatment really depends on the position of the stone, depends on the size of the stone. अगर जैसे मैंने बताया कि अगर stone जो है 6 मिलीमीटर से ज्यादा बड़ा है, 4 मिलीमीटर से ज्यादा बड़ा है, and sometimes it can be the size of a golf ball as well. It can be really, really large. Then obviously you have to take treatment. You can't ignore it, whether you get pain or whether you don't get pain. And the chances of success of treatment are high if it's a smaller stone. The chances are high if it's on the upper part, and the chances are high if it's in the ureter. And the chances are lower if it's very large, and the chances are lower if it's in the lower part of the kidney. So these are just a few things to remember while you are taking treatment.
And डॉक्टर बता, जब ये स्टोन निकलता है, फॉर एग्जांपल अगर सर्जरी के करा या किसी तरीके से स्टोन निकला है, तो हाउ इम्पोर्टेंट इज इट उसकी जानकारी लेना कि एक स्टोन के कंपोनेंट क्या है, किस चीज का स्टोन बना है, वो कितना इम्पोर्टेंट है?
So लोग करते हैं, उसको टेस्ट करते हैं because there are different kinds of stones. The commonest, of course, 50% of the stones are calcium oxalates. Not 50%, 75% of stones. And the balance 25%, there are many types, so I'm not getting into the technicality of it. But the other 25% are uric acid stones because of high uric acid, oxalic stones. So obviously, अगर आपको पता है कि किस कारण से वो स्टोन है, you can then change your diet. So for example, अगर कैल्शियम ऑक्सलेट है, then आप कैल्शियम की कमती चीजें खाएंगे, आप प्रोटीन कमती खाएंगे. अगर यूरिक एसिड की वजह से है, तो आप एनिमल प्रोटीन कमती करेंगे, रेड मीट कमती करेंगे. So it can give you an idea on the kind of diet that you should have, depending on what kind of stone you have.
जी. डॉक्टर बता, कुछ स्टोन जैसे बड़े होते हैं, जैसे आपने बताया कि स्टोन कैन बी ऑफ द साइज ऑफ अ गोल्फ बॉल इटसेल्फ.
जी.
तो ऐसी कोई मेडिकेशन है जिससे हम इस स्टोन को मेल्ट कर दें, क्रश कर दें, ताकि ये धीरे धीरे करके यूरिन के थ्रू पास आउट हो जाए?
See, this is a very difficult question to answer because it depends on individual case-to-case basis, and it's not easy to kind of give a generalistic advice on this. But I'd just like to say this, जैसे मैंने पहले बताया था कि अगर स्टोन जो है 4 मिलीमीटर से कमती है, तो ऑटोमेटिकली पास हो जाएगा 30 दिनों में, ऐसा माना जाता है. So the chances that it will flush out as long as you drink more water, drink anything which is diuretic, like beer, I'm told is also something that I'm not recommending it to anybody, but it flushes out. It flushes out the kidneys as well. So anything that flushes the kidneys, छोटे stone जो है वो निकल जाएंगे. Now, when you come to medium-sized stones, again, depending on the position, they can pass out with medication, but sometimes you have to break them. So you have to either use some, kind of lithotripsy, sound waves, which you do now, or something else to break the stone into smaller pieces and then allow them to pass. Similarly, homeopathy दवाइयाँ भी हैं ऐसी, जैसे बर्बेरिस वल्गैरिस एक बहुत अच्छी दवाई है होम्योपैथी में. अगर आप उसके 20 बूंद लेकर पानी में डालेंगे और दिन में 2 टाइम पिएंगे, आधे कप पानी में, तो it will actually dissolve your stone. It will kind of break the stone, and when the stone breaks, see if it is large, then it will keep eroding the ureter. जैसे वो निकलेगा उसको चीरता जाएगा, और अगर चीरेगा तो दर्द होगी और साथ में खून निकलेगा, so it can cause damage. But अगर वो soft stone है और अगर उसको पीस दिया जाए तो फिर वो रेती के जैसा निकल जाता है. तो अगर वो रेती के जैसा निकल जाएगा तो आपको मालूम ही नहीं पड़ेगा, आसानी से निकल जाता है. So the idea really is to break the medium sized stones into gravel, into एकदम रेती के जैसे उसको बनाना, उसको इतना तोड़कर टूट जाए that then it passes out on its own. And then the challenge, of course, like I said, is then there is again another 50% chance of it coming back again. So I think this is also where homeopathy helps. It's very important कि आप जो है constitutional treatment ले when you are well, not when you are sick. So जब आप किडनी स्टोन्स है तब आप बर्बेरिस जैसी दवाइयां ले, बट जब आप सही है और आपके फैमिली में उसकी हिस्ट्री है और आपको एक टाइम किडनी स्टोन हो गया, आप चाहते हैं कि बार बार ना हो, then you should take medicine like lycopodium, which is good for right-sided kidney stones, and other such constitutional medicines. So take constitutional medicine when you are well to prevent recurrence of kidney stones.
Got it.
And take acute medicine when you have the problem.
Got it. But
like एक और बहुत आसान, एक बहुत अच्छी दवाई मेरे दिमाग में भी आई है, which I like to share. So most of this pain is spasmodic pain, because it comes like this, comes in spasms. It's very severe. So one of the medicines in homeopathy, a biochemic medicine, is actually called magnesium phos-6,6. So अगर आप mag phos लेंगे, it's a homeopathic antispasmodic. So it's like a painkiller, but it has no side effects and it has no drug dependency.
Okay.
So आप वो भी ले सकते हैं, regularly interval to kind of. But of course, I mean, you have to be a little careful, because sometimes the pain is really very severe. I mean, I've seen patients even passing out with the intensity of pain. Sorry, you were asking something, and
मैं ये पूछा था, आपने दो मेडिसिन का नाम लिया था, एक लाइकोपोडियम और एक
बर्बेरिस वर्गेरिस.
तो आपने एक बताया कि एक जब आपको प्रॉब्लम है तब लेने के लिए, और एक एज अ प्रिवेंटिव. नाउ अगर आपको प्रॉब्लम है और आप एक मेडिसिन ले रहे हैं, कैन यू आल्सो टेक लाइकोपोडियम टू प्रिवेंट फर्दर स्टोन गेटिंग?
Yeah, you can. Yes, yeah, you can. Yeah, you can. You can take one constitutional medicine.
हाँ जी. To
kind of to prevent it. But like I said, the best time to take it, because what people do is they only take it for the acute phase. तो एक टाइम पथरी निकल गई तो अभी तो दर्द नहीं है. And like we always say कि आप डेंटिस्ट के पास जाते हैं जब आपको दर्द होगा, आप डॉक्टर के पास जाते हैं जब आपको बुखार या पेन होता है, नहीं तो आप जाते ही नहीं है. They said that doctor and God are two people you remember only in trouble, unfortunately. तो मैं तो ये कह रहा हूँ कि जब आप सही होते हैं, जब आप when God has blessed you, then also think of God and also be grateful for what you have. So similarly, I'm saying जब आप ठीक होते हैं तब भी आपको डॉक्टर के पास जाना चाहिए, because prevention is better than cure. And I think we don't give enough focus on prevention in medicine, which we must do.
अच्छा डॉक्टर साहब, when you had mentioned that leaving the kidney stone in your kidney when it is not, it's asymptomatic, etc., so it may lead to kidney failure. आपके ऑब्जर्वेशन में, आपके एक्सपीरियंस में, what percentage of such cases lead to kidney failure?
So it's difficult to prescribe, talk about a specific percentage, but like I said, it depends on the position of the stone and the size of the stone. So if the stone is blocking the passage and it's large, then there'll be a back pressure. And when that back pressure, like I'm saying, kidney is also a very silent sufferer. It suffers for a long time. So you're talking not about months, you're talking about few years, most probably. So, and also it depends if you've got comorbidity, the one word that we learned in COVID time. कि अगर आपको diabetes भी है, then also when you are diabetic, also you get kidney failure. So when you are diabetic and you have kidney stones and the stones are in such a place where you have a back pressure, then there's a chance of getting renal failure.
Got it.
And if it's just a normal stone somewhere down in the ureter, then I mean you don't need to worry. वो आपको दर्द करता रहेगा time from, and you see also क्या होता है कि sometimes it travels on its own. So every time when it travels, जब वो अपनी walk लेना शुरू करता है, then it's going to cause you some problem, because उससे दर्द तो होता ही है, because it's unnatural, going down and passing down. So that's when you feel pain. So actually, pain, sometimes pain is good, because जैसे हमें इमोशनल दर्द होता है तो अच्छा रहता है, हमको जिंदगी का जो है मजा आता है, लुत्फ लेते हैं हम जिंदगी का, we appreciate it. So similarly also I think that it's also nice to pain is an indicator that something is wrong with your body. So like in the case of kidney stones, that sometimes your stone is probably moving, especially if your pain moves. तो पहले अगर यहाँ पे पेन था और फिर नीचे चला गया, that means the stone has moved from top to down. It's a good sign in that sense.
एक क्वेश्चन अभी किसने डाला है कि Berberis will single dose of mother tincture in water, or do you advise repetition?
No, I advise repetition because it's in mother tincture. So mother tincture form में आप 20 drops लीजिए, आधे कप पानी में डालिए और उसको फिर regularly पीते जाइए. Keep sipping it and you will then find that you'll be able to pass stones. वो एक डोज से नहीं चलेगा. You have to take it frequently.
And Dr. Batra, किडनी स्टोन का इलाज होम्योपैथी में किस चीज तक का हो सकता है और किस चीज के बाद हमारे को सर्जरी में जाना पड़ेगा या कुछ और मेडिकेशन लेनी पड़ेगी?
See, like I said, it depends on the size and the position of the stone. So अगर जो है वो स्टोन जो है वो ज्यादा बड़ा नहीं है, अगर वो ब्लॉक नहीं कर रहा है, अगर उसकी पोजीशन ऐसी है कि यहाँ पे नहीं है, but somewhere here or here, then there's every chance that it will come out with homeopathic medicine. But if it is large, if it is blocking, because you don't want to get kidney failure, then it is better to use either lithotripsy or some kind of surgical laparoscopic surgery where you get, where you can actually then get it removed very easily. But like I said, see, the bigger challenge, according to me, there are two challenges in kidney stone. सबसे पहले तो ये है कि आपको जो दर्द होता है, उसको आपको संभालना है, because it's very severe. So you don't want pain to come, so you want to make sure that you're pain-free through a kidney stone. And number two is you don't want back pressure, you don't want any side effects to come long term. So you want to make sure that you're able to pass the stone out easily with the least possible pain. And the most important thing is you want to make sure it doesn't recur again. So अगर आप surgery भी करेंगे, it can recur again. But with homeopathic medicine, the chances of recurring are very low. That's why you need to take proper treatment.
Got it. And एक स्पेसिफिक क्वेश्चन भी हमारे पास आया था कि 9 mm किडनी स्टोन है एक किडनी के अंदर और दूसरी किडनी में 6 mm किडनी स्टोन है, तो इज होम्योपैथी अ वायबल ट्रीटमेंट ऑप्शन? बट इसमें मैं एक क्वेश्चन में ऐड करना चाहूंगा सर, टू फाइंड आउट कि इफ यू हैव अ प्रॉब्लम इन बोथ द किडनीज, यू हैव स्मॉलर स्टोन्स इन वन किडनी एंड यू हैव अ लार्जर स्टोन इन वन किडनी एंड यू आर एडवाइज्ड टू गो इन फॉर सर्जरी, should the surgery be done on both the kidneys, or we should leave the one with the smaller stone and
no. If you have to do it, you might as well do it on both. But I'm saying one of the reasons is that lots of the time, I would say in a majority of cases, you can avoid surgery through homeopathic treatment. Again, I'm saying not always, but in most of the cases. So the answer is yes, that whether you have, see, the medicine is similar medicine. But medicine doesn't realize whether it's left side or right side kidney. I mean, there are specific medicines for that as well in homeopathy. But it's a medicine to crush stones, और उसको रेती में करके उसको बाहर निकालना है. That's the basic function of whatever medicine we are taking, homeopathic medicine. So it really makes no difference whether it is one side or two sides. It's just the size of the stone that is important. Like I said, the positioning is important. And अगर आप homeopathic दवाई लेंगे तो both the stones can pass out with homeopathic medicines without surgery.
Okay. And my last question to you, I know it's 4:30 now, but my last question to you, Dr. Batra, is that the importance of food when it comes to kidney stones. अगर आपको पता है कि आपके पेरेंट्स या किसी को पथरी की बीमारी थी, लेकिन you don't have that problem as on date. So as a prevention, what kind of food you need to take care of? कि आपको क्या खा सकते हैं, क्या चीज अवॉइड करनी चाहिए ताकि आपको पथरी की बीमारी के चांसेस कम हो?
So let me divide this into two parts. The first part is कि क्या नहीं खाना चाहिए और क्या खाना चाहिए. So जो नहीं खाना चाहिए depends on the kind of stone that you have. तो अगर for example आपको like I said calcium oxalate है, तो आप calcium यानी milk products आप कम लीजिए, आप high protein कम लीजिए. अगर आपको uric acid stone है फिर आप जो है certainly red meat आप कम करिए, because that will push up your uric acid level, and your stone can also get worse. It can add more stones. So depending on the kind of stone that you have and the kind of problem you have to change your diet. That's one. Okay, so obviously anything which has got pathri, like जैसे spinach होता है, साग होता है, गुआवा होता है, जिसमें बीजे होते हैं, चीकू होता है, ऐसी चीजें जो है नहीं खानी चाहिए जी. अभी क्या खाना चाहिए? So what, so obviously, the rest of it is good. Normal vegetables, fruits, all that is good. So और क्या खाना चाहिए? What is specific? So there are two specific things that you can have. The first thing is nimbu pani. So it has citric acid, and citric acid is expected to break, that's something that, really you should be doing. And I think, let me just, I'm just losing my thought on what is the second thing that I had thought of. Yeah, apple cider vinegar. Okay. That was the other thing. So apple cider vinegar is the other thing. So apple cider vinegar and lime juice. These are the two things that you should have to help to break stones. And of course, drink lots of water. Lots of water means lots of fluids, because that will help your kidneys to flush the stone. Right.
Syed Gasakyan has mentioned tomato. Now, is tomato to be had or to be avoided?
Again, seedy stuff. So anything with seeds,
that should be avoided. Well, Dr. Batra, yet another very, very informative session. आप जिस तरीके से जिस आसान शब्दों में आप समझाते हैं, ये सबके काम आता है. I mean, we've been getting a lot of positive feedback from people, not just people who watched it live, but जो बाद में भी Instagram के ऊपर जो हमारे वीडियोस हैं उनको देखते हैं बाद में जाके, बहुत अच्छा फीडबैक आ रहा है in terms of usefulness. So Dr. Geetanjali is also resonating my thought. Thank you, sir, for all the information. God bless you. So with that thought, we'll end this conversation for today. Next week, we are talking of two things. मेरे दिमाग में एक चीज आ रही थी सर कि हमने हेयर फॉल के बारे में बात करने के सोचा है, बट एक और किसी ने मेंशन किया था कि प्रीमेच्योर वाइट हेयर. तो मे बी हमने, क्योंकि हेयर फॉल के बारे में पहले भी बात करी है, दोनों क्लब करके क्वेश्चंस ले लेंगे. And
let's keep the hair on the head till then.
Yes.
And greetings and good wishes from Dubai. I am addressing a keynote address for an international conference over here.
Oh, lovely.
So, which is why I'm here. But all the very best, and whatever you want, whether you want to color your hair or whether you want to keep the hair on the head, either way we'll discuss both.
Hair being the topic for next week. Until next Thursday, 4 p.m. Thank you so much.